The second part of this lecture, now we discuss the digital health business model, and we see how this business model burn right in, especially in this sector, because there is nothing new about different business model, but some company create a different way how they can sell, how they can create their products, and this represents an extremely important aspect that we have to consider, especially for the digital healthcare, because the digital healthcare, as we already see in the previous lecture, is quite new. So there are new kind of business model that was developed by different companies. But also it's very important that we start to understand also the difficulty for a new company to enter in this market. So one of the first model that was developed in the digital health business is called the digital therapeutics, DTX. So this term is used to describe the use of a clinical validated digital technology to support health and well-being. And the definition of DTX encompasses both behavioral intervention, such as the typical online coaching weight loss program, for example, as well as a system involving wearable devices, artificial intelligence, and big data analytics. So the potential of digital therapeutics is to be used together with an alternative to drug therapy has gained interest, and even outside the traditional care and life science company. So today this kind of business model in healthcare have been primarily focused on the actual drug or devices, and only after was offered as an increasing value in terms of creating new services. So with the digital therapeutics, the focus will shift, including also patient needs, and have an holistic integration of stakeholders and data usage. So this model, the business model, was not just to create an alternative way how to treat the patient, but also this include the creation of platform, for example, for the online coaching, for the weight loss, and as well as also integrate some digital devices to collect the data to measure several aspects of the health. I want to show you here, just for this example, how, for example, in North America, how is increasing the digital therapeutics market. This is a study that was conducted by the Grevia View Research. So starting on 2021, 2022, we're talking about $1.7 billion, and it looks like that become 5-6 times higher by 2030. So these include the patients, these include the providers, these include the payers, the employers, and others. So basically they create this business model to the entire healthcare systems, but was not just like any sort of maybe traditional company that introduce new products and sell straight to the customers. In our case, when we're talking about health system, patient are the customers. But they also create this platform, these medical devices, that is very useful as well for the providers of for example, the public health sector, for the payers, that could be both the patient but could be also the public health institutions, and all the employers. When we're talking about employers in this sector, we're talking about all the employers especially in the public health systems. So starting from the administration to the therapist, specialists, doctors, surgery department. So this is represent all the employer. So basically this company created this product that affect the entire sector. So it's not just the typical company, for example, that sell imagine, for example, watches. That the watches is buy just by any sort of customer. You can buy online the watches, and this is the product. So you can succeed or not, but you focus only on your customer. In this business model, they're looking for to have the whole sector of the healthcare. So including all the people that are employed in the healthcare sector. Another business model, what is called the prescription digital therapeutics, and this, of course, how you understand, is focused on the prescription, because the prescription represents another important part of the entire healthcare systems. So for a digital therapeutic solution to be reimbursed by the payers, a demonstration of clinical, economic and quality of life values is required. So this will vary depending on the disease area being targeted at the solution. And there are typical multiple stakeholders involved in this decision process. So we're talking about the typical situation where, for example, you pay by the patient pay by their own, for example, a medical examination, and then after they apply for the reimbursement that, for example, in the European countries made by the regional municipality or urban municipality. Anyway, this is a very long process because in some way you have to check if the patient really need this, for example, medical examination. You will see if he had all the requirement to be reimbursed by the local government. And you need a lot of data about this patient, of course, before reimburse all the money that he anticipated, for example, for a medical examination. And there are, you can imagine, several multiple stakeholders that are involved in this process. So what is very important from the company that develop a platform and also analyze all the data, that first of all you need robust data from randomized control trials, budget impact and cost effectiveness study using claim database and the real world evidence studies, and as well patient advocacy group that may request a specific outcome measures such as improvement in quality of life. So it's very complicated the way how, for example, the reimbursement works, especially in European country. In the United States is different because this reimbursement generally is made by the insurance company. Anyway, also for the insurance company, this very complicated process to assess if, for example, customers they really need this medical examination, or if they decide by their own to make a medical examination just to control his or her well-being, or if maybe he's care about something. So before the reimbursement, they need a lot of data to control if his clinical situation really require this medical examination. So it's very important that you create a platform. There are companies that create this platform that put all together all this data and give the possibility, for example, to the insurance company in the United States to analyze and assess if this customer real can be reimbursed by the insurance company. Another business model is employer as customer. So this model lends itself to solutions that improve employee productivity by addressing chronic disease that reduce costs for self-insured employer. So the employer typically pay a set of fee per month for each employee on the program. Although outcomes is based on payment. For example, Hello Heart put fees at risks based on their ability to to lower blood pressure for their users and deliver a return of investment to the clients. So this is the typical business model where the products and the services, the digital services, are delivered to the employer and not to the customers. So not to the traditional vision of the company that sell products or service to the customer, to the employer. When we're talking about employer, we're talking about all the employer inside the healthcare systems, the public healthcare system, or even in the private healthcare system. But we're talking about I repeat, because you have to understand that we are not talking about the employer of the company. We're talking about the employer of the entire healthcare systems that should be also private. So a private clinic, of course, there are several employers that work there. So they create this company. They would like to create this digital devices or digital platform to help to increase, for example, the efficiency to the administration, to the therapists, to the doctors. So they have a different vision, this company. They create services, digital services to all the people that are employed inside inside this company. And payer as customers, this is a different way. So the payer offers solution, for example, to policyholders, pay a set of monthly fee to solution provided for each members. In this case, the payers is represented both by the customers in terms of patient, but also by all the public healthcare system. Then we have the healthcare or pharmaceutical company as a customer. So basically this company create a services that is dedicated to for example, to the pharmaceutical company. So this is an intersectoral services. But you can imagine how many people, how many workers and how many employers are into the pharmaceutical company and all the correlated sector. So this can take to form different form of business model. So a services that is offered to patient free of charge, then monetized either by healthcare or pharmaceutical company, pay for the insight generated by patient data. So generally they create for example, using the Umotive company, they create a model where the pharmaceutical company license technology for research, usually generate a software as services that is based on enhanced clinical trials. So they create this software that, of course, the software aims to be sold and traded to the pharmaceutical company just to gain a lot of information and collect the data and also manage this data, but at the same time is free of charge to the patient. So the patient can upload all their data into the software, but the software, of course, is sold by the Umotive company to the pharmaceutical company, because for the pharmaceutical company, have the data analytics is extremely important. Extremely important because when you have millions of data related to the patient, you can imagine how you can test your drugs, your medicine, and how you can also assess which different reaction have the patient on the medicine as well. Another model is direct to consumer. So here the solution is to sold direct to consumer who pay out of pocket. This is the typical business model in any sort of trading and commerce sector. So selling to consumer, of course, sometimes can be difficult. However, as many are reluctant to pay additional health-related costs on the top of the health insurance. So this is much more the case of United States, of course. So moreover, the non-healthcare world app subscription tend to cost between 99 cents to $10 per month. So this limit consumer willingness to pay as they view this range of comparator. So the direct-to-consumer model can be an effective way to test a new products rapidly. So the company chose this model to further its goal of product excellence, shortening the sales cycle and collecting user data rapidly. So it's very important that you understand that there are different models. Of course, you don't have to know all the models, but it's very important because the healthcare system create a new way how the digital company can implement their business. So you can sell your products, the company, straight to the consumer. They can sell straight to the employer of, for example, into all the public healthcare sector. They can create an app or a software where can be used both by patient and specialists. Of course, the specialists will pay this software, but will be free of charge to the customer. So there are different ways how they enter into the market.